How to scrub in for surgery. Operating rooms must always remain sterile environments to protect patients from being exposed to harmful bacteria during medical procedures. Being exposed to these bacteria during a medical procedure could lead to an infection. This is why surgeons and all other members of the surgical team need to follow special directions known as aseptic technique when scrubbing in. This procedure requires a little bit of prep, attention to detail during the actual scrub, and a special method of drying off. While scrubbing in, you need to decide whether you want to time yourself or count scrubbing strokes. If you're timing yourself, your goal is 5 minutes for the entire procedure. If you're counting strokes, you'll need to aim for 20 to 30 strokes per side of your hand or arm. Prepping for the scrub. Enter the designated changing room. Regardless of the facility you're operating in, the location must have a designated changing room to reduce the possibility of contamination. Here, you'll change from your street clothes to your scrubs. After surgery, you'll return here to wash up and change back into your street clothes. Tie up your hair. This applies if your hair is long or medium length. Pull it back in a topknot or bun. Don't allow any hair to hang over your face. Make sure that your hairdo will easily fit under your head covering. Cover your hair. Hair, dandruff, and squamous cells fall from your head without your noticing. Therefore, covering your head is essential for your patient's safety. Wear a standard surgical head cover or hood provided by the hospital. Make sure the material is free of lint and is large enough to fit all of your hair. If you have sideburns and/or facial hair, you should wear a surgical hood to cover these areas. Avoid surgeon skull caps, which do not adequately cover your hair. Put on your surgical mask. This is to prevent bacteria, saliva, or mucus from contaminating your hands as you scrub. It also covers facial hair, which can carry dandruff or contaminating squamous cells. Make sure the fabric covers your nose and mouth. Tie each set of strings behind your head. The mask should be secure without cutting off your airflow. Remove your jewelry. Jewelry carries microbes that could infect your patient. Take off your watch, bracelets, rings, etc. and put them in your locker. Make sure nothing remains on your hands or arms. Put on your scrub suit. Your suit should consist of a shirt and pants. Put your shirt on first. If you're wearing an undershirt, bra, or camisole, your shirt should cover it completely. Not even the collar or straps should emerge from the neckline of the scrub shirt. After your shirt is on, put on your scrub pants. Tuck your shirt tail into the waistband to prevent billowing or skin shedding into sterile areas. Open the packaging of a new scrub brush. Each brush is individually packaged to remain sterile. Tear the backing away from the plastic packaging. As you open it, look for an enclosed nail file. Take the file in your dominant hand. Keep the scrub brush in the packaging for now. Adjust the water temperature to a warm setting. Antimicrobial soap works most efficiently in warm water. Avoid excessively hot water, which could lead to dry and irritated skin. Cold water should also be avoided because it keeps soap from lathering properly.